We're starting the show with an important message from the Oregon Health Authority. We're talking about mental health and suicide prevention and the resources that are available. With me now are Ebony Clark, Director of the Behavioral Health Division at the Oregon Health Authority, Lisa Saunders, Founder and Executive Director of Faith Bridge Portland, and Dr. Keith Dempsey from Keith Dempsey Counseling and Consulting. Good morning, everyone.
Good morning.
Okay, Ebony, let's start with you. One of the resources available is 988 Oregon. So let's talk about that and this latest campaign from the Oregon Health Authority.
Yeah, well, we are continuing our Oregon 988 campaign because we know that 1 in 5 individuals nationally and within Oregon are impacted by mental health. And when you are impacted by mental health, it leads to loneliness, depression, anxiety, and so many things, including suicide. And we want to prevent that. And so 988 is a free, anonymous, confidential resource, 24/7, 365 days a week, where you can call for any reason, and there's going to be someone on the other line, a trained counselor, that is going to be there to support you and guide you and walk you through whatever it is that you need.
Yeah, and it's a lot of people are utilizing this. The numbers of calls are very high.
Yes, absolutely. Yeah. We actually, in 2025, we actually answered and supported about 93,000 individuals, and that's about maybe 7,000 or 8,000 calls per month.
Wow, wow. Dr. Dempsey, tell me about behavioral health, why this is such a challenging topic for people, and how you incorporate 988 into your practice.
Yeah, you know, I've been doing this work for over 30 years. And this is what I've seen. In so many communities, it's hard to have this candid conversation. In so many communities, in so many places and spaces, when we do have this conversation, it's done with fear, stigma, and shame. And I always say mental health is a human experience. No matter who you are, no matter what your position is, we are trying to navigate this thing called life.
I'm not in crisis.
Even so, what happens is there's a bigger narrative that says if you are trying to get help, if you're seeking help, something is wrong with you, you're alone, and there's no one else like you. And when people listen to that narrative, what happened is they don't reach out and get help. So they're in isolation. As Ebony said, they feel alone, and the healing doesn't happen when you're alone. So that's when we need to reach out. And so utilizing 988, it's me saying, yes, mental health is a human experience. In addition to 988 supporting that, saying, give us a call. You'll have someone here that's willing to talk to you, that won't judge you, and will be here to support you and your healing.
Yeah. Lisa, what are some of the other reasons people may want to reach out to 988?
For me, it really is a cultural issue as well. Healing has not been something that has been widely talked about in the Black and Brown communities, so having a number like this is really important. And what I love about 988 is that any culture can reach out, and they're going to find somebody. I mean, you could press 2 and you'll get to a Spanish speaker, right? And there's 240 languages that are in interpretation. So it's something that every culture can embrace, and that's important.
Yeah. And why, Dr. Dempsey, will ask you, why is it important to raise awareness of 988? We're seeing the commercials that are airing, letting people know that it exists. So why is it important to do that?
It's a resource, and folks are suffering alone. And when you're alone, you're not consulting with a professional. You're consulting with a person that is sad, anxious, depressed, and no healing happens in that place. So, you know, we have to let folks know, and the awareness is there, and we have a resource there.
Yeah. What can people expect when they call or text 988? What will happen on the other end?
Yeah, well, individuals can expect within 20 seconds that somebody will be on the other line and will answer, specifically a trained counselor, and they're there to support you and to listen, but also offer recommendations, strategies for coping, and connects you to community-based resources.
Yeah, they give referrals as well. And what if you maybe are concerned about a family member or friend? Is 988 also an option for that?
Absolutely. It's a resource that we are using. For instance, we'll be having a healing camp for Black and Brown girls. And one of the things we want to do is educate our girls and our parents that this number is available for them to call. And we are actually using this number as part of our suicide awareness protocol with our women and our girls, right? So we're normalizing calling and also making you're aware, especially parents. I have a child, I don't know what to do.
Yeah.
They're acting out in school. We see this a lot. What do I do? And they feel isolated. A lot of our parents feel isolated and alone. So knowing that they can call a number and get some support is really going to be important.
And I just want to say one key thing that you said, Lisa, normalizing.
Yeah.
There's this myth that if you talk about suicide, it increases the likelihood of someone attempting or being successful. But actually, our research demonstrates it actually is a very strong preventative measure. So being able to talk with someone around your concerns or for yourself or someone else is a powerful tool.
Yeah. Well, I appreciate you sharing. And if any of this resonates with you or with a friend or a family member, please call 988 or you can visit 988oregon.org for more resources. Thank you so much for coming today. Really appreciate it.
Thank you so much.
Thank you for having us.